foster to adopt system was, I guess, as friendly as it can be. The goal of fostering to us was to try to reunite families. In certain cases, though, we understand that that's not always possible. And so that transition was handled very, very professionally and with courtesy.
The Children's Shelter really does a good job evaluating our children who are placed into foster care. And as a result of that, when you're a foster parent, you're not really flying by. They're not just taking a child and sort of dumping them in your laps and saying, well, see you later. It's important to rely on the Children's Shelter as a foster parent to get guidance and to really understand the child's situation when they're placed with you, and then be pretty adaptive. Every child is different. Every child has different needs, and some of the children here have needs that you may not have run into before. So it's important that we sort of let the children walk their own path and then gradually help them to get to a place where they feel comfortable and safe and where they can develop perfectly normally.
We work with prospective foster families and get them acquainted to what it feels like to be a foster family. They come to inquiry meetings and they get to understand what it's like, what this process is going to be like, but what it's going to be like once they have the child in their home. We hold their hand through the process. We'll do a home study, we'll do all the training that they need, and then as they have the child in their home, we're there 24 hours a day, 7 days a week, with any questions or anything that they may need.
We were in our mid-40s and becoming first-time parents, so we had a lot of learning to do, and the shelter could help us with that. The shelter provided us with a case manager that could help us get through the paperwork that's involved, help us with things that we weren't familiar with. An example would be foster children have Medicaid and how to understand the doctors that you need to go to and how to manage that. There are visits that need to be coordinated, and it is real nice to have someone to help you with that.
The staff in our foster care department are experienced and know what they're doing. They've done this, they've been there, done that for a lot of families. We currently have about 150 children in our foster homes. They're there to answer all the questions through the process and all the questions that people might have and give them the support that they need in their homes.
At the Children's Shelter, they provided us with case management services where a social worker will come out to your home and visit and check on the child and check on you and see how the integration of the family is going. There's therapy support, so licensed clinical professionals that come out, and they help too with making sure that the transition into the home is good.
Now, the Children's Shelter has comprehensive programs for everything. So they've got medical and dental and psychiatric here. If you have a foster situation, for example, where you're adopting multiple foster kids, it's great. You can bring them all in at the same time to see the doctor, to see the dentist, to see the psychiatrist if necessary. You don't have to make, 3 and 4 different appointments all over town. Everything's available for you right here at the Children's Shelter, and that's really neat. If you're a new mom and you're a little uncertain about different things, we have the Nurse-Family Partnership. And for teenage pregnant moms, we have Project Moss, which helps them get through high school and learn essential parenting skills. So it's really a total package here at the Children's Shelter.
I think that people come to want to adopt for various reasons. Sometimes it's because they can't have children of their own, and sometimes they just feel a mission or they feel led to it. It's not so much a misconception in the media that you can adopt or it's more difficult to adopt. I think that there's just little to no information a lot of times about children that are here. It's actually very inexpensive to adopt children here domestically versus going to another country, and the amount of international paperwork and legality that is involved in that. So it's a fairly simple, straightforward process if people have the right heart and the right motivation to do it.
The support we give, I think, is really critical. A lot of people have never done this. And when you come to being a foster parent of a child, have a new child in your home, there's a lot of anxiety, and we're there to make sure that you're okay, to make sure that you have all the necessary things in your home, but also the skills and the support you need. When you have a question at 11 o'clock at night, what do I do? you have somebody to call, and we're there for that support.